Hello and welcome to the Prolapse advice video developed by the Pelvic Health Physiotherapy Department in Cardiff and Vale University Health Board. In this video, we will discuss what prolapse is, what are the causes of prolapse, and give you advice and treatment options. What is prolapse? Prolapse literally means to fall or slip out of place. The condition results in a bulging of one or more of the pelvic organs, such as the bladder, uterus, or rectum, into the vagina. This occurs due to a weakness in the supporting tissues, such as the muscles, ligaments, and fascia that usually help to hold them in their correct positions. If we begin by revisiting the pelvic floor anatomy so you can understand where all of the organs should be sitting. If we look at this from the side, we have the tummy here and the lower back and buttocks here. Sitting behind the pubic bone, we have the bladder, which fills with urine, and the urethra, which is the tube we pass urine from. We then have the vaginal opening, with the front of the vaginal wall helping to support the bladder. At the top of the vagina is the womb or uterus. We then have the rectum, where we pass stool from the back passage here, and the back vaginal wall helps support the rectum. You can see the bones of the spine here, and at the very bottom is the coccyx or tailbone. Can you see this hammock or sling-like group of muscles? These are the pelvic floor muscles. They stretch like a hammock from your tailbone at the back to the pubic bone at the front. As you can see, they wrap around the back passage, the vaginal opening, and the urethra, and this is what helps us to control our bladder and bowel. We will now discuss the different types of prolapse, showing you the extreme versions to make it very clear what is happening in the picture. It is highly unlikely that you will have a prolapse to this extent. Anterior vaginal wall prolapse. This is the most common prolapse and occurs when the bladder and/or urethra move back into the vaginal space. This is also called a bladder prolapse or cystocele. Symptoms typically include a slow stream of urine, not feeling that you have emptied your bladder fully, frequency, urgency, and stress incontinence. Uterine prolapse. This is when the uterus or womb drops into the vagina, and this is the second most common form of prolapse. Vaginal vault prolapse. This can occur after a hysterectomy. This is when the top of the vagina may fall downwards into or out of the vaginal opening. Posterior vaginal wall prolapse. This is when the rectum bulges into the back wall of the vagina. This can also be known as a rectocele. Symptoms typically include difficulty emptying the bowel properly and needing to support the bulge as you open your bowels. Symptoms of prolapse. We have already discussed some of the bladder and bowel symptoms relating to prolapse. In addition, women typically describe a feeling of aching, dragging, and heaviness down below. Some will report a feeling of something between the legs coming out of the vagina. You may experience some lower back pain or lower abdominal discomfort. Finally, these issues can cause intercourse to be more difficult or uncomfortable. Typically, all of these symptoms are better in the morning and get worse as the day goes on. How common is prolapse? 80% of women have some vaginal wall laxity, which means that there is some weakness in the supporting structures. The incidence of prolapse peaks at 65 years of age. 50% of women over the age of 50 have prolapse. Only 2% of women without children develop prolapse, which usually involves the uterus. The lifetime risk of having surgery for prolapse is around 11%, and many women do not need surgery to improve their symptoms. What are the different causes of prolapse? If you have watched the video, What is Incontinence?, you will have learnt the different causes of incontinence. These factors are also what causes prolapse. If you haven't seen that video, here is a short recap. There may be a genetic link to incontinence and prolapse, so you may be more at risk if your relatives also have these symptoms. Hormones. As women, the hormone estrogen helps to keep our pelvic floor muscles strong and our vaginal walls stable. Leading up to the menopause and during it, our estrogen levels drop, and this can lead to incontinence and/or prolapse, or cause these symptoms to become worse. Our estrogen levels also dip just before and during our periods, which is why many women will also report this as a time that their symptoms are worse. Common life stages for a woman increase the risk of incontinence and prolapse. Pregnancy causes hormonal changes, and carrying the weight of baby on the pelvic floor muscles for 9 months can weaken them. Childbirth itself can cause injury to the pelvic floor through tears or a cut into the muscles known as an episiotomy. Other factors in childbirth can be a long, active pushing stage of labour, a large baby over 8 pounds 8 ounces, and deliveries involving forceps or the Ventouse suction cup. We have already discussed the impact of menopause on incontinence. Aging. As we get older, we lose muscle mass from our bodies, and this includes the pelvic floor muscles. Our skin and tissues change as we get older, and this can also have an impact on our tissues down below. Treatment for prolapse will depend on how large or what stage the prolapse is. If you have no symptoms, there may be no need for any treatment at all, but it is worth following the below information to prevent the prolapse from potentially worsening over time. There are a number of lifestyle changes you can make which can have a big impact on your symptoms. We strongly encourage you to watch the Important Lifestyles Changes video for more information. If you are having issues with bladder symptoms, please watch the How Your Bladder Works and How to Train Your Bladder videos. If you are having problems with bowel symptoms, please watch the Bowel Habits and Managing Constipation video. We strongly recommend that anyone with a diagnosed prolapse and/or prolapse symptoms watches the following videos: Where is your pelvic floor and what does it do? And how to exercise your pelvic floor muscles. Working to strengthen these muscles is a proven way of improving prolapse symptoms, as the muscles play a huge role in helping to support your pelvic organs. Remember to avoid heavy lifting as able, and when lifting, use the knack by squeezing your pelvic floor muscles to give you some support underneath. Avoid high-impact exercise, as this will cause downward pressure and strain on the pelvic floor. Opt for low-impact exercise instead. During any activities, don't hold your breath or push down, as this will strain the pelvic floor. Remember, always exhale with effort. For example, if you are carrying the wet washing, bend down, squeeze your pelvic floor muscles and breathe out as you stand up. Then do a half squeeze of your pelvic floor muscles as you are carrying the wet washing to the airer. Always remember to use the knack for coughing, sneezing and laughing. If you are able to, we strongly encourage you to take rested breaks in the day with your feet up for 10 to 15 minutes. This will help the pelvic organs return to their correct place and will help to ease your symptoms. Pessaries are devices that are inserted into the vagina to provide support to the prolapse. These can help to reduce symptoms alongside making lifestyle changes and doing regular pelvic floor exercises. They are also a good option for women who want to avoid surgery. Pessaries need to be fitted by a specialist nurse or doctor and may require some trial and error to find the best type and size for you. There are pessaries available that mean you can remain sexually active. Surgery is typically considered the last resort, and most women will not be considered for surgery without having gone through physiotherapy first. In addition, 30 to 40% of women who have had surgery will have their symptoms return, known as a recurrent pelvic organ prolapse. Therefore, it is best to commit yourself to making small lifestyle changes and engaging in pelvic floor exercises, as this has high success rates without any side effects. We really hope that you have found this video interesting and informative. Please ensure that you watch the other recommended videos that relate to your symptoms.